Hello, everybody. Thank you once again for joining us tonight. Welcome to our public debate. As you can see, the resolution that we are discussing today is the U.S. government should implement a higher sales tax on junk food and sugar-sweetened beverages. I did try to implement some memes. I have been accused of making these memes biased, so please don't let that change your decision at the end. UF Speech and Debate is an organization that is funded by student government, and we allow students to practice their debating skills, public speaking skills, writing skills, anything that you can think of. So let's get on with it. So for those of you who may be unfamiliar with the structure of public debates, I have some key info here for you. So the resolution is the proposition that is subject to debate. That's what we're debating. The affirmation is the team that argues in support of the resolution, and the negation is the team that negates the resolution or says they don't agree with it. There are two types of speeches, and then we also have a crossfire period. The introduction or constructive speeches are going to be the first two speeches that you hear tonight. That's just the speech that lays out all the points for that team's position. And the crossfire will be a 3-minute questioning period in which the opponents of the constructive ask them about their argument just to figure out exactly what it is. And then we have the rebuttal speech, which critiques the opposing team's arguments. And here we have a little order just to help you keep track of what you're going to be seeing. Here are some definitions because everything is contentious in debate. So the sales tax is the price added to taxable goods that is collected from the purchaser at the time of purchase. Junk food is food that has low nutritional value, typically produced in the form of packaged snacks, needing little or no preparation. And sugar-sweetened beverages are beverages that come to the consumer with added sugar. And now we have just a couple of reminders for both in-person people and Zoomers. Zoomers, please keep your cameras off and your microphones muted. Here in person, we have a giant screen, so if you do wind up coming up on the screen, you're gonna look like Big Brother to everyone in the room, so I highly advise against that. In-person people, please keep your phones silenced and your mask up. I recently read an article where our football coach has claimed that the reason our football team has been performing this way is because everybody has the flu. Am I saying that if we lose to FSU, it's your fault if you're not wearing a mask? Our next reminder is there will be an audience poll at the end, and we encourage guests who are not judging or debating to stick around and vote. Those of you who are for class credit, if you'd like to vote, you can just write it on your attendance sheet and I will count you. Fourth reminder is that the debaters may be arguing points that they don't believe in. What you see tonight is a demonstration of analytical writing skills and performance skills rather than a reflection of personal beliefs, so please keep that in mind. Once the debaters finish speaking, judges, I will give you 5 minutes to private message me or hand your decisions to me. I will give you little slips. After the outcome is announced, I will ask you to elaborate on your decision, so please keep that in mind. And for those of you who are here for class credit, I will be sending out a link to a Google form for those of you on Zoom and handing you guys a sheet for those of you in person to take attendance at the end. With that being said, we have some fresh people here tonight, which is very exciting. On the affirmation, we have Tobias, and let me turn the camera so you can see him. I feel so much better. Zoom is very complicated. Okay. Give me one moment. Okay, so I will turn the camera so you can see. There we go. On the affirmation, we have Tobias and Gillen. And then on the negation, we have Lone Wolf Rachel. This is the first time we've had a 3-person debate. This will be very interesting. But with that, I will hand it over to the debaters. Once again, thank you guys for coming, and I hope you enjoy.
Audience and distinguished judges. My name is Tobias. Tonight, my eloquent partner Gillen and I will stand in firm affirmation of the resolution that the U.S. government should implement higher sales tax on junk food and sugar-sweetened beverages. Our support of this resolution is based on the following 3 conditions. First, implementing the tax from public health. Second, this is the most effective policy that could be implemented to this end. And third, this policy will have a positive impact on our economy. Finally, we would like to note that we're not suggesting any specific percentage increases, or the definition of junk food, but merely the concept of a junk food tax in general. Let's not sugarcoat it. Sugar is deeply unhealthy. It leads to chronic diseases such as cardiovascular disease, diabetes, and non-alcoholic fatty liver disease. And we need to take drastic steps to reverse the current chronic disease epidemic. This brings us to our first contention. Implementation of this tax will improve public health. According to the National Institute of Health, 100 million Americans were obese in 2018. Furthermore, 45% of the US population has at least one chronic disease. According to the CDC, poor nutrition is one of the 4 major lifestyle contributors to chronic disease, with the other 3 being excessive alcohol use, lack of physical activity, and tobacco use. When you look at these risk factors, you will notice that we already did text 2 of them. Tobacco and alcohol already face so-called sin taxes. It's not possible to tax a lack of physical activity, so that leaves junk food consumption as the only risk factor not subject to an extra sales tax, meant to discourage consumption by consumers. And why wouldn't it be taxed? These are not food items necessary for survival. Nobody's going to keel over because they couldn't buy their lunchtime soda. Indeed, if through a tax, junk food prices were to rise, all indicators show that consumption would decrease. A review by the NIH of 160 different studies of food price elasticity found that a 10% increase in soft prices would, that a 10% increase in soft drink prices would likely decrease consumption by 10%. This clearly shows that the tax proposed by the resolution would be effective in reducing consumption of sugar-sweetened beverages and thus chronic disease rates. Yes, this policy may cause some short-term discomfort, but is it not justified in order to save millions from years of suffering? Our second contention is that a tax is the most effective policy to promote a more nourishing diet and encourage a healthy lifestyle. Government policies are notoriously bad at achieving their stated goals. Prohibition failed at cutting alcohol consumption. The war on drugs has destroyed the market for illegal substances. And even a nationwide push by Michelle Obama, the First Lady, didn't cut national obesity rates. But simply, mandates don't work. No to government advertising or education efforts. What does work? Market-based solutions. People listen to their pocketbooks. If junk food is more expensive, people will buy less of it. When Hungary implemented the junk food tax, they saw a decrease in consumption of junk food tax directly due to the tax. Producers even tweaked recipes to increase their nutritional value, with 40% improving their recipes to avoid the tax. Similar results can be found in Mexico, where an average soda consumption decreased by 7.6% in the first 2 years after the tax was implemented. Soda taxes have been shown to be effective in the US, with Berkeley's 1 cent per ounce tax, reducing sugar-sweetened beverages consumption by 21% in just 4 months. This change was focused in lower-income communities, which are disproportionately burdened by obesity. Besides being clearly effective, this policy is unbureaucratic, making it free of red tape and easily enforceable. Companies can just make a slight adjustment to their current sales tax software. A tax on junk food and sodas is common sense policy proven to reduce consumption of foods, directly shown to contribute to chronic health problems. Our third contention is that America will see a long-term benefit from this tax. A long-term economic benefit from this tax. Healthy eating habits will go a long way in reducing the gigantic healthcare expenses the US faces every year. On average, healthcare costs the nation $3.8 trillion each year. People with chronic illnesses, the same illness for which the consumption of junk food strongly correlates with, accounts for 81% of hospital admissions. 91% of all prescriptions filled, and 76% of all physician visits, according to fightchronicdisease.org. The associated spending works out to $5,000 per capita. 99% of Medicaid's budget is spent on chronic disease treatment, as is 83% of Medicaid spending. The numbers are staggering. Obesity, heart disease, diabetes, and other chronic illnesses are costing the people and economy a fortune. The US saw a similar scenario in the 1970s when the government regulated tobacco companies due to the due to their damage to productivity to public health. They also pose the high tobacco taxes we see today. Tobacco-related illnesses was costing the states a fortune in healthcare costs, so they imposed a tax to recoup some of these funds and to make smoking less appealing by making it more expensive. Though a junk food tax may present a cost today, it is investment in the future. Citizens will recoup the cost of the tax in medical savings, avoiding years of costly and painful chronic illnesses. For all the reasons above, we've shown that harms of over-consuming junk food, or as I like to call it, food-like substances. We have clearly shown the harm of too much sugar intake and that junk food taxes are a proven pragmatic way to reduce junk food consumption. Additionally, we have demonstrated how this will be beneficial from an economic standpoint by reducing healthcare costs in the long run. If we do not act swiftly on improving public health, millions of Americans will needlessly suffer and die from and with chronic diseases. It is for these reasons that we urge you to vote for the information. Thank you.
All right, we will be getting into our first crossfire.
Are you ready for me?
Yes.
Okay, so moderator, are you ready?
Yes, ma'am.
Affirmative, are you ready?
Yes.
So throughout your argument, you kept comparing sugar to tobacco and alcohol. Should junk food really be taxed under a sin tax like these items?
Can you repeat the last sentence, please?
So you kept comparing how sugar is similar to tobacco and alcohol, and those items have a sin tax applied to them. But should junk food be considered the same as these substances and taxed the same way?
Absolutely. That's what Bill and I totally believe, because as the study from the CDC shows, it's one of those 4 major lifestyle habits that leads to all these chronic diseases that the US are suffering from. Yes, it is.
But unlike tobacco and alcohol, food is a necessity. And for some people, especially those in low income areas, junk food is the only food they have access to. So why should we raise the tax on something that's a necessity?
Yeah, food absolutely is a necessity, but not empty calories. The problem in US society and a lot of Western countries in the world is that we are overfed but undernourished. So we have an excess of calories, but we don't have enough nutritional value.
But in some areas, people don't have access to healthier food. So why should we increase the prices of the only food they have access to?
I would admit that, or I agree, there is a problem with people having access to food. However, I kind of reason it as in, if someone is dehydrated, would you give them a liquor bottle? I don't think so. So giving people who are in need of nutritional support, giving them empty calories doesn't help the cause of getting healthy and nutritious.
So what would you say is the main goal of the sugar tax?
The main goal is to encourage consumers to a healthier diet, to reduce their consumption of so-called junk food or food-like substances that they don't need whatsoever.
And so do you think these taxes are the only policy that we could implement that would effectively achieve this goal?
I would claim it is the most effective policy that we could implement to achieve that goal.
Sorry, could you repeat again? I couldn't quite hear you.
I claim it is the most effective policy that we could implement to get to that goal.
But if some people don't have access to healthier food, how are they supposed to eat healthier?
I don't think you can make it as easy to say they don't have access to any healthy food. I acknowledge there are, for some people, and we don't talk about, let's not talk about 90% have access, right? Where you would maybe agree that it is indeed better. Let's talk about the 10% may not have access to all the healthy foods. There's still a difference. Maybe they can't get the fresh vegetables, but they may get maybe the dry beans that are there that they can have access to, which is still much better than all the junk food.
All right, that is time. Thank you both.